No matter how what the future presents, we all are humans. So keeping in mind the people we are also dealing with, do appreciate that human touch.
I believe, in my opinion, the most important thing is solving a pain and how to use the digital solution.
Visibility of the healthcare practitioners on their patients. Sometimes people, patients, families have to travel and walk multiple kilometers to actually find a doctor because the number of doctors is actually quite low.
This time period during COVID was quite difficult for us, but it was a time when people realized the power of technology in many different areas, including in healthcare.
Hello, everyone. Welcome to the Axios International webinar. Today, we will discuss innovative strategies for patient-centric care in the digital age. I am Sudashni Christopher, the head of communications at Axios International, and it's an honor to have you with us today. A little bit about Axios International. Since 1997, Axios has been pioneering global access to healthcare by designing, implementing, and optimizing creative access strategies and sustainable access solutions, impacting more than 9.5 million lives in over 100 countries. Today, we meet with a common purpose. That is to discuss how innovative strategies can improve patient-centered care in the digital age. It's about giving people a chance at life by providing access and taking them one step closer to much-needed quality healthcare and treatment. So before we start the discussion, let's get to know our panelists. Ola Ali Eldin, Chief Operating Officer with Zeta, driven by a deep-seated passion for leveraging technology to improve lives. Ola is committed to championing positive change in healthcare and bridging the gap between technology and healthcare. Hello, Ola.
Hello, Sudashi. Pleasure to be with you today.
Next, we have John Noel Saba, Digital Consultant at Axios International. Throughout his career, John Noel has worked with both private and public sectors globally, from the UK to rural Uganda. Most recently, John Noel has worked closely with NHS organizations in London on how to leverage automation, as well as successfully use data and insights to drive better decisions to improve patient outcomes throughout the United Kingdom. Hello, John Noel.
Hi, Sudashni. Thanks for having me. Excited to be here.
And next, we have Ben Davis. Ben has over a decade of experience helping clients at the intersection of business, healthcare, and emerging markets. His work focuses on enabling data-driven decisions by health system investors and managers. Hello, Ben.
Hi, it's a pleasure to be here.
So once again, a warm welcome to all of you. Your expertise will be of great value in helping us better understand how to empower patients through digital technology while leveraging patient data to improve access programs. We will also discuss what the future of digital technology looks like, upcoming trends, and how digital technology impacts patient care. Let's start with how digital tools can empower patients in different settings. So first off, I'd like to ask John Noel, how can digital solutions increase patient visibility?
Thanks a lot, Sudashni. That's actually a really good question. And it's actually one of the main advantage, really, of digital solutions and digital health in general. And to answer the question, I'd like to take it at three different levels. The first level is, if we look at a systemic level, the impact of digital solution for patient visibility, the first thing that springs to mind is really electronic health records and how they have transformed, the health landscape globally. Because with these electronic health record, it really allows organizations and healthcare practitioners to have this visibility of the patient throughout their continuum of care. And I thought I would like to share a bit of a story today, which actually really happened, I think, represents, the impact of these kind of solutions quite well. So when I used to live in London, a friend of mine actually broke her arm as she was cycling. And London is in the south of the United Kingdom. So she went, she got surgery, she got the care she needed in London, which was great. But then she moved to Glasgow, which is in the north of the United Kingdom. And, she was required to go see the physician for a follow-up. And what she realized when she got there is that the physician had absolutely no idea of her status, her condition. He had access, he did not have access to any kind of information in regards to the medical past of my friend. So she had to sit there, and re-explain, relive through all this trauma, etc., for upwards of 30 minutes. And this was actually one of the main pain points when we were working with the NHS in London, was that patients, and that's why for one physician, but sometimes patients have to go through 3, 4, 5 doctors and re-explain their condition and their actually, and their medical records, one by one. So the electronic health records really helps to have the majority of the patient's health information that can be easily transferred from one point of care to another. So that was a systemic level. Now, if we start to focus a bit outside the hospital, which is actually what we focus here, what we focus on here at Axios, for me, there's two aspects. First one is the visibility of the healthcare practitioners on their patients, right? And this is really where you get into the realm of technology such as telemedicine, remote diagnosis, remote monitoring, and wearables have actually been extremely useful when it comes to be able to monitor patients outside the hospital. And so we work in low to middle income countries environments. And in these countries, sometimes people, patients, families have to travel, and walk multiple kilometers to actually find a doctor because the number of doctors is actually quite low. So having this visibility and access actually to these healthcare practitioners remotely does alleviate a major health burden, in different areas of the globe. And finally, last but not least, I'll say, on the patient level, I know we do take our smartphones for granted, but they're actually a very powerful tool when it comes to tracking and managing your health as a patient, right? They can track their health metrics, especially again when you combine them with wearables through apps, etc. It allows them to adhere to treatment, communicate with healthcare providers, and it's also a way for them to get education materials on their health, and it just makes everything a bit easier and a bit faster. And again, here at Axios, with our applications, we have really focused on trying to make our different processes much faster and much more accessible to patients. So in order to apply for one of our programs, some patients would have to send us 40, 50, 60 documents, and it's either they would send us by mail, physical mail, or they would come to the office and deliver them. And now they can just upload everything through the app in 5 minutes, and it's done. So yeah, I think digital health solutions are reshaping kind of healthcare landscape, and the start of all this is really the patient visibility. Because in order to care for someone, you need to understand them, you need to understand their needs, and this is also how you can start personalizing your care to your patients. So it all starts with visibility, in essence.
Yes, yeah. And you brought up a very valid point, John. So reaching out to patients and to have the visibility, we are talking about a lot of information and data on digital platforms. So this brings me to the next questions, and I'd like to ask from Ben. What specific types of data should we prioritize to effectively monitor patient progress and outcomes? Also, where can we find this data and information?
Yeah, so there are two main types of data I would propose we focus on. So first, it would be data that's focused specifically on the patient's experience. So what's the direct perspective of the patient, the steps that they follow, the treatments and interventions that they receive, what are their preferences, and what are their outcomes? And as Jean-Noel mentioned, a lot of this is going to be captured in electronic health records. And then a second level of data would be one step removed from that patient experience, but still influencing that patient experience. So this might be something like the healthcare provider staffing or hospital operations. How can we describe the environment that will eventually affect the patient's experience and their outcomes? When thinking about data, I wanted to note that at Axios International, we do not run clinical trials. So when we talk about data, our data are centered around patient access programs. And so the outcomes that we look at are aspects like the duration of treatment and the reasons for treatment discontinuation within a particular program. In terms of data sources, electronic health records for sure. Then we also have some applications that patients and physicians and pharmacists and other providers can interact with called Axios Plus. Then we could have traditional surveys. And I also wanted to highlight observation, or more like passive data collection. So in the case of a time and motion study, you might have someone observing, watching a process, and using these timings to be able to identify bottlenecks in a process, or even doing so with passive data collection through some type of technology that can monitor movement and things like that. And in the case of improving the patient experience, we want to focus on measuring aspects that we are able to change. So when we're measuring and using data for decision making, we need to also have agency to make those decisions. So we need to draw the line between the data we're collecting, the analysis we're doing, and who's going to be able to use those data to make changes to the patient experience.
Thank you, Ben. Thank you for that a comprehensive perspective around in and around patient and how we could improve patient experience. So, what do you think, Ola? Like, how can healthcare organizations like Axios, and through these platforms like Axios Plus, and I suppose Visita is also in the digital front end. How can healthcare organizations then stay ahead in adopting new digital health technologies to make them patient-centric?
Okay, so this question, I believe, Sudashi, is really important, so that all our digital solutions, uh, like, is focused on patient, and how, and even so, you have two aspects in this: patient centricity, and how the patient is going to use all these digital solutions that companies provide, and from the other end, how the providers will again benefit and see the value behind these solutions, because it's interrelated. The providers, patients needs to go to these providers and have the services. I believe, in my opinion, the most important thing is, first of all, solving a pain. Like, if the patients really face a pain within the ecosystem of healthcare, or within the journey of his health journey, you need to solve this pain. And the other most important thing as well is how to use the digital solution, being a user-friendly, having a user-friendly interface. These two aspects, in my opinion, are really important to increase the adoption to the usage of the digital solutions. So digital companies like Visita, and I believe also, of course, Axios, they need to focus on what is the journey, what is the traditional way, how the patient move between his healthcare journey. Like, I could give you a clear example. We are a digital platform where we have different kinds of digital solution, like teleconsultation and e-pharmacy platform. We have changed our interface a lot of time for the patient when using the e-pharmacy platform, so that it could fit his needs and it could be more user-friendly. In this part of our world, we have like some drugs where there are market shortage. So we have adopted our solutions for the patient to upload his prescription or type in the product name, and then the cart will search in the surrounding pharmacies to have the availability listed for the patient, so that he could find the pharmacy near to his house which has most of the products available. Right, this haven't come from day one. You have to like change the features and ask patients and ask the provider what are the best way to get the service and have value from it. So there is a need for patients, as John mentioned earlier, maybe through telehealth, to go and travel for maybe 4 or 5 hours to reach a doctor. So using the telehealth consultation, you could have this patient at his home, reaching out to a specific specialized doctor in a city where this patient is in a rural area, and consult him through audio or video if needed at certain cases and certain specialties. So it's important to empower patients with data and technology for them to have an easy journey throughout their lives.
Thank you, Ola. I think you touched upon what Ben and John talked about, patient centricity is all about personalizing and really understanding the patient needs. And you also talked about bringing in the e-commerce kind of like platform, um, a platform that really works for a patient and their caregivers and their families for their needs. So coming back to you, John, why is it important to have a system that is tailored to the needs of all the healthcare stakeholders, not just patients? We are talking about when you look at the patient journey or their experience, there are many people who always come and meet a patient or their families at different levels or different steps of their patient journey. So, like, why is it important to have a system that is tailored to everyone?
Thanks, Sudashi. Another very good question, as expected. So, to answer the question, I'd like to take a bit of a step back, because it's crucial to recognize the human element, that's involved. And this is where I put my behavioral scientist hat on. So if you take physicians, for example, or any other, healthcare provider, before they're a healthcare provider, they are human. And a very human question to ask is, what's in it for me? So in other words, what needs is this solution going to fill for me, right? Or for my team, etc. And that means that in order for these solutions to be successful and adopted, the perceived value of using them must be high. In order to be high, they must be personalized because they need to fit specific needs. So that's, and triggering a personal investment from the users, whether it is the physician, the pharmacist, etc. So that's only, so that's one side of the scale. The other side is saying, okay, well, why am I using this solution? And this is where you need to have a balance between, the perceived value, but also the reason. And for most healthcare providers, is because it's going to make life easier for me, but also for my patients, right? And it's only when you get this balance between the two that you can really expect healthcare providers or just any stakeholders to use these digital solutions and unlock their potential. For us, bringing back to just what we've done, because we're quite proud of it when it comes to Axios, when we looked at our physician app for doctors to refer patients, what we realized very quickly is that physicians cared about two things mostly: time, right, and convenience. So we have developed the application so that the time it would take for them to refer a patient, which used to take a couple of days, actually now took a couple of minutes. So this is the what's in it for me question. And this translates into the patients reaching their treatment faster, which is the, why question. One of the main benefits, if I just look at this, is, well, the main benefit is that they actually use these solutions if it's tailored, which means that they can unlock the potential and the value not only for them, but for their patients or any other stakeholders they might interact with. And I do want to finish on a point that for me is very important. And this is why, as Ben mentioned, we have Axios Plus, which we now call a digital ecosystem, is that it's not just about having separate solutions or digital solutions for separate stakeholders. We need to make sure that they're interconnected. And because all these healthcare practitioners, all these stakeholders, right, need to have visibility on the patient. So information needs to be needs to flow across all these stakeholders, because this is the only way that the patients can actually get the right support at the right time and in the right way throughout their journey. So on top of that, for me, this is really where we start looking at multidimensional support. I say for me, but it's also at Axios in general. This is something we're really looking into, and we're quite passionate about. It's not just giving the treatment to the patient, but it's really about offering this multidimensional support, making sure that the support is personalized and that it actually, fits the needs of the patient when they need it.
Thank you, John. So you talked about interconnected system, right? So then we are talking about interconnected data from all these different healthcare stakeholders. So Ben, from your experience, how can we use these data to improve patient access programs more like holistically?
Yeah, at a high level, there are four main ways that we can use these data. So the first is to identify areas that need improvement and use the data to try to understand those and to fix them. The second is to help tailor personalized support for each patient. The third is to, once we've put in place a particular type of intervention or program, to determine if it's working. So we're monitoring the data on the outcome side to see if it's doing what we thought it was going to do. And the fourth, at a higher level organizationally, would be to drive strategic decisions and decide, what are the directions that we want to take patient access programs in the future. So I'll give a few examples of concretely how we do this at Axios. So the first is we have our patient management system in Axios Plus, and we're often using data in that system to monitor the time between the steps from referral to starting treatment. And when we look at the time that's required for each of those steps, we're looking for bottlenecks and then doing root cause analysis to figure out what are the bottlenecks and working with our ops team to address those bottlenecks and increase the throughput time with the benefit to the patient of being that they are able to start treatment sooner. The second, we're looking often at reasons for non-enrollment. So that's when a patient is referred to the program, but for whatever reason, they don't actually make it to the step of receiving their first dose of treatment. And we look at those solutions and we look at those problem areas and we try to see, are there solutions that we can implement that would directly address those problem areas and get those patients to that final step of receiving treatment. And the last is related to adherence. So we have some data coming in and we're looking at potential red flags for why patients might not stay on treatment for the term that's been recommended by their physician. And again, trying to put in place proactive solutions that would allow those patients to not only start their treatment, but to stay on treatment longer term. And the theme here is that we're really trying to improve patient outcomes. And as Jean-Noel mentioned, we're trying to get patients to reach their treatment faster and also to stay on treatment.
Thanks, Ben. You talked about like how on each step of the patient access program or giving a solution, creating a solution, how we can bring in new and innovative ways using these data. So, Ola, how do you see this support from the healthcare stakeholders, like let's say providers, insurers, caregivers, for adopting emerging trends and tech-driven treatments, if I may say?
Sure. One of the challenges, Sudashi, as well as I can see it as an opportunity, is adoption and the rate of adoption to different healthcare solutions, whether it is used by the providers or the patient. In my opinion, 2020 was a really bad year in terms of the COVID and what we saw as a human that year. But also it was, in my opinion, a booster for the adoption of the tech solutions and the digitization or digital transformation in different sectors. And one of them is the healthcare industry. Because prior to that, you need to go and convince, like we are in Visita, we used to go and convince the provider to use the solution, the practice management, the raise the awareness on teleconsultation, and so on and so forth. And the adoption wasn't that good. But after COVID, after you have to have a distance, you have to stay at home, immunocompromised patient can go and see doctors, and the situation that we are all aware of, the providers as well as the patient realize the need of accessibility through digital. Like you need to connect to your provider or your caregiver for follow-ups, for the chronic medication, for early diagnosis through different means. So yes, the adoption has highly increased, but also it also depends on you as a tech company and your role to show them the value of the solution. As Jean mentioned earlier, what's in it for me, right? It's cost effective as well from a provider perspective. They can using the solution check and and have visits for a larger number of patients, right? When the whole practice management is digitized, in terms of booking the doctors, the follow-ups, like some follow-ups for just for routine checkups, doesn't need the patient to go into the hospital, right? It could be through teleconsultation, it could be through wearables, just the doctor using telehealth solution, and the patient on the other side having the gadgets and being aware of the readings of the patient, and if it's stable, it's okay, and if it's not, then the patient needs to move the. So what I mean is that the adoption has increased a lot and enhanced a lot, but you need as tech company to show them the value behind it, and also training the staff in the provider side how to use it, because they are not aware, and most of them are afraid of using digital solution, and they are more used to paper and pen still till now in most of the cities and most of the countries. They might think that because I'm used to writing through a paper and pen or an Excel, for example, that is the faster. No, it's not. Like Jan said, that it might take to upload or mail them a couple of days, but by using only the digital solution, which is user-friendly and solve the pain, then here comes the value to the provider and to the patient. And I think it's very important that organization and the mindset of the management is always towards keeping an eye on innovation and what's new and what's trendy, and try it even if it's on a certain department or a certain group of patients, and so have the value from it, and you can then optimize on that too for better outcomes as well.
How the technology adoption itself, it's kind of quickened because of the pandemic situation, but then again, we have to ensure that we don't fall back to our older ways of doing things, but keep on the track, doing the right way, so that it's easier for all of us to fulfill this adoption or to enhance and move on, So now we've spoken a lot around this topic, and thank you all again for bringing different perspectives around the table. So let me play a short clip from a patient who has been enrolled in an Axios-supported program for ulcerative colitis since 2022. So this patient will share how the support from Axios Plus, MyHealth for patients, an app from a digital ecosystem, has made his experience smoother.
Hello there, my name is Hamza Nadeem, and today I'll be answering some questions and sharing my experience regarding the MyHealth app.
How has the MyHealth app changed the way you access treatment? Is picking your medicines from the pharmacy now easier? Are you able to check the medication releases with ease?
Yes, making it easier to pick the medicine from the pharmacy is one of the main features of this app. I can directly check the app once my program coordinator has released the medicine. The app will also give me the location of the pharmacy. I just have to visit the pharmacy, provide the security code, and pick up the medicine.
Do you feel more in control of your health data and medical records since using the app? And is there anything else you would like to share about your experience with the MyHealth app?
Yes, I do. This app provides me with all the information I need to manage my treatment. It does have the record and log of my treatment history. From the very beginning, my program coordinator guided me on how to use the app, or if there is any issue with the app, my program coordinator helps me get it resolved.
So now let's open the floor for discussion based on what we've just heard. Hamza Nadeem shared some of the ways digital technology is helping him easily navigate the treatment journey. And this has brought us to some important questions that we must answer. How can we further enhance patient support using these digital solutions? And what are the key takeaways from patients' experiences that can help us improve our programs in this digital age? So now I invite our panelists, all of you, to share your thoughts and reflections. And this question is for all of you. With a focus on patient-centered care, as we all discussed, and patient engagement, What are the opportunities and challenges in the digital health ecosystem? So, if I can, I'd like to bring Ola. So, what are your views on this topic?
I believe, Sadashi, as we've seen the video, the digital solution have enhanced the outcomes and improved, I could say, the quality of life patient after reaching efficiently and effectively to the right healthcare provider at a short period of time, with using less effort. I believe we as tech company should continue to develop and enhance and empower the patient with accessibility solutions and with data, and as well with the new digital trend like AI trends. Like I believe that all of us have now been involved in new ways to develop the solutions. Like we at Visita, like for example, are in a phase of enhancing the transcription or reading of the medical prescription, whether because that handwriting of the doctors are really not really clear for the normal patients. So you could using OpenAI certain techniques and certain models to enhance the transcription using these models to facilitate or enhance the access of the patients to the provider for what they really need to do. So we need to keep on focusing on what are the pains and how we could solve these pains using the normal trends, whether from the new trends, for the patient side and for the provider sides. This is one example of the transcription of the prescription. Another example for which we have used from the provider side is that we developed using LLM model a tool to speed up the mapping of the product list of the pharmacies to be available on the app so that the patient could have the full inventory of drugs available for their dispensing the medication. So what I mean is that we need to be closer to the patient and the provider on the ground, using testing the traditional way and how we could digitize it using different new trends and making them aware of its value and how it is being used.
And Jonoel, what do you think?
So first of all, I'd like to echo Ola's point in regards to making sure that digital asset solutions in general, whether it is apps, whether it is wearables, or whatever it could be, are user friendly. Because when we think about it, the adoption meaning users actually using these solutions is the basis for everything else. It goes back to a very old statement, which is you can have the best product in the world. If people don't know about it or people don't use it, then it doesn't matter because nobody actually unlocks the value. So I think user adoption is extremely important. I think it can also present a challenge if we go back to the systemic level, because we do have, different countries with different healthcare systems. So having this global approach can be quite challenging. Some countries even have, fragmented healthcare systems. So, pushing digital adoption and digital solutions can be sometimes a challenge where, in systems that are paper-based or where people have, their automatisms, I would say, or their ways of doing things that or their habits, ways of doing things that they would have been used to for the past couple of years. The other aspect that I'd like to touch on, which is quite important, but I'm sure my friend Ben here is probably going to talk a bit more about it, is the data privacy and security aspect. Because, and this is something we're seeing not just in healthcare, but really, across the board, given that more and more sectors are becoming reliant on digital solutions. As this level of reliance on digital increases, the data privacy and security mechanisms, needs to be aligned with this reliance and this needs on digital. So that really needs to remain a key point of focus. And the last kind of challenge that I'd like to touch on is one which is quite close to us here at Axios, is the digital divide. You know, we work in 43 countries, and in some countries, you know, patients don't have ready access to digital solutions or to smartphones, which is, you know, one of the main challenges of it. Or on the other side, they might have access, but they have a limited, you know, level of digital literacy, and it's just, you know, this this discrepancy between, if we're looking at digital literacies, for example, it's very hard to tailor a solution to one group of patients, you know, and then realizing that half of patients actually can use it. So this is where, you know, we need to bring the balance between making sure we have solutions for everyone. Now, I don't want to just talk about the challenges. Obviously, you know, I want to bring a bit of positivity in all of this. But I think throughout, you know, this discussion, we have highlighted a lot of benefits for digital solutions. You know, as in, you know, it's a way for us to offer the right type of support, the right type for the patient, higher personalization of care, better patient visibility, you know, adoption and all the value it can unlock, as Ola mentioned. And, you know, I'm a techie as well. I like data. I think we can do a lot with data. And I think that these solutions allow us to gather more data, and we can actually really start, you know, as organizations that have an impact in healthcare for our patients and for all stakeholders, you know, that we can really start having and making these data-driven decisions, with a focus on predictive analysis, and predictive care, preventative care, which is incredibly important. And this is where, you know, I draw back from my time at the NHS, where sometimes patients would have to come and wait for 6 hours at the hospital. And we actually used, you know, we did these kind of models to make sure that we could map out the scheduling of the hospitals for patients and the staffing of them, just so that, you know, you could actually reduce these queue times, which I think is just, you know, one part of the equation. But there's a lot of ways that you can do, you know, that you can use data to refocus on predictive care. So be a bit proactive rather than just reactive. But this, I think I'll let Ben talk a bit more about it, I'm assuming.
So agreed with all the points that have been made so far by Ola and Jean-Noel. I really like the idea, Ola, that you mentioned that this time period during COVID was quite difficult for us, but it also it was a time when people realized the power of technology in many different areas, including in healthcare, and it changed mentalities. And so I think there is a ripe opportunity to continue this trend, to not slip back into old ways, you know, of paper and pen-based record keeping. But it's the moment to sort of move that digital transformation forward. So that's a big opportunity. There's the opportunity to integrate data from patients more into the decisions and the processes that directly affect patients. And I think it's really now about shortening that feedback loop. So we have data coming in, and we have decisions being taken, and we have analysis in the middle. And to the extent to which we can have a pipeline that will take that data quickly, you know, perform analysis on it and move it um, toward an output that can be used by decision makers for the benefit of patients. I think this is a really incredible opportunity at hand. And this ties into what Jean-Noel was mentioning about, you know, prediction and you know, having close access to these metrics that will eventually, you know, benefit patients in near real time. And certainly there are challenges, so I'll speak to some of those as well. You know, I work a lot with data sets, and one of the most obvious challenges I have is data quality. So it's garbage in, garbage out. So we need to make sure that when we're collecting these data, we're doing it in a good way, and putting in place also the mechanisms for cleaning the data before they're analyzed and used for decision making. Um, a second and related point is regarding the analysis workflows that I just mentioned. We want to be able to take in many different types of data, and as people have new ideas about different metrics to collect, that we can take them in, and that the automation and the processes that we have for crunching through those data and generating outputs is, you know, flexible enough that we can use those data while still keeping the speed in that process, and you know, having outputs that are available quickly. And a third challenge that comes to mind is the regulatory challenge. I think healthcare has typically been slow to adopt technology, and potentially for good reason. But this is something that I think will remain a challenge, especially as technology and these sort of digital solutions have an increased role in physician practice and overall in patient care. So, as an organization, Axios, I think the important thing is that we are trying to keep all of these solutions for the benefit of the patient and make sure that the patient stays central to everything that we do.
I'd just like to add to that, Ben, if you don't mind, because I have a sentence that sparks to mind, which it's actually an old mentor, that told me that, and um, I've kept it close ever since, which is, especially when you're looking at digital and digital health, it's fix the boring bits first. It's very easy, to focus on the new kids on the blocks, on all these flashy new technologies that come. But, as an example, just what Ben mentioned, it's very, it's great to talk about predictive analysis using AI, using data modeling. But if the quality of your data is not there, you're not going to be able to do that. And I think that it's very important, especially for all health organizations, to really pinpoint their pain points, right? And create this robust and robust and resilient, foundation to then be able, to add these technologies one step at a time. And I've seen a lot of companies that, you know, um, implement all these new technologies, and then they run the problem of 2 or 3 years later down the line with a couple of $1 million invested, having to do, the basic exercises that they would have done in terms of discovery actually prior to implementing these new solutions.
Thank you all for sharing your expertise and insights today. We discussed some important topics around innovative strategies and how that can all be patient-centered in this digital age. One of the key things that we also discussed is no matter how the future presents, what the future presents, we all are humans. So keeping in mind the people we are also dealing with do appreciate that human touch. So that is what brings this topic even more important, how we could be patient-centered and how we can ensure sustainability throughout all for all of the players, all the people who are in the course of supporting a patient. So thank you for your contributions and invaluable thoughts in terms of understanding how we can improve this patient care through digital innovation. So once again, I want to thank all of you for your presence and participation and your willingness to share your knowledge and experience. This event would not have been possible without your support and collaboration. Thank you, and have a nice day.
Thanks, Sudashini. Thanks, everyone. And thanks again, Ola. It was very nice having you indeed.
Thank you. Thank you so much.
Axios, transforming access to healthcare.